Kristen, and we're at UT Southwestern. Today we're going to be talking about women's heart health and heart disease prevention. So today with our guest we have Dr. Monika Sanghavi. Dr. Sanghavi is a clinical cardiologist with a specialty in women's heart health. So please, as we're going along, please be sure to share the conversation, and also don't forget to like and love when you hear something you like. If you want to ask a question, please do so in the comments. But for now, let's start off with Dr. Sanghavi. So tell us a little bit, what is heart disease?
That's a great question. Thanks for having me. And I think heart disease, when you hear about heart disease, it's a little bit confusing. What exactly does it mean? First of all, I want to say that cardiovascular disease is the #1 cause of death in the United States, and almost every minute a woman is dying from cardiovascular disease. So it will affect someone you know, and so it's really important to know what the risk factors are and know how to reduce your risk.
Okay. So you mentioned risk factors. What are some of those more common risk factors?
Yeah, so there, in terms of heart disease, there's multiple different types of heart disease, and there's heart failure where the structure of the heart may be affected. There are electrical problems. There are problems that can happen with the valves of the heart, which are the doors and windows of the heart, or with the plumbing of the heart. And so oftentimes when we talk about risk factors, we're talking about problems that can affect the plumbing, where cholesterol or high blood pressure, these things can affect what happens to the blood vessels of the arteries around the heart that supply oxygen. So coronary heart disease is what we typically think about when we think about heart disease, but it's actually, there are multiple things that are included.
Okay.
So risk factors for coronary artery disease or coronary heart disease include things that are modifiable and non-modifiable. So I like to divide it that way because it's important to understand that some things you can't change and some things you can. And so in terms of the things that you can change, include things like your diet, your weight, the amount you exercise.
Gotcha.
And then if you have risk problems such as diabetes, high blood pressure, or high cholesterol, keeping those under good control because those are all risk factors for heart disease. Things that are non-modifiable include your age. Unfortunately, as we all get older, we are more likely to develop coronary artery disease. Other things, gender, so or sex. Men usually develop heart disease a little bit earlier in life than women, but it still affects both men and women, so it's important to understand that. And then race, there are certain ethnicities such as African Americans have a higher incidence, and so it's really important to understand that there are certain things that we can't change. And also family history.
Right.
If you have a family member who had heart problems at an early age, it puts you at increased risk for having heart problems at an early age. So it's important to talk to your family, know whether this is something that runs in the family.
So with the modifiable ones, one of the questions that we see a lot online is people wonder, okay, so I know I can't change my age, I can't change my sex, and with the maybe the ways to prevent heart disease, what are some ways to prevent it? You mentioned diet and exercise. Do you have any specific examples?
Yeah, so I think, in terms of exercise, the current recommendation is about 30 minutes of moderate intensity activity 5 days a week, or that adds up to about 150 minutes per week. Okay. And the good thing is, and what I tell my patients all the time is that we know that it doesn't have to be all at one time. So if you take you have to have 30 minutes of activity in a day, you can divide it up into 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. And I know for a lot of women who are moms and who are working, it becomes really hard to find 30 minutes of time to do anything. And so being able to break it up is really helpful. I also often recommend a pedometer in order to track your steps. And the reason why is because, we kind of think, sometimes we think we probably do more exercise than we actually do. And so having a pedometer that actually tracks the number of steps that you are doing at any time. So if you have like a goal of 10,000 steps, every day how close you are to that goal.
So with that, since a lot of phones have pedometers in them now, is it okay if you track it on your phone, or maybe you have like a Fitbit or something like that?
Absolutely. Any way of tracking, I think, is helpful because it will allow you to keep track of your goals and track progress over time. So even if you start at 5,000 steps, you can slowly increase over time.
Okay. That's good tips there.
And then in terms of diet, you know, moderation is the key, I think, in terms of anything. But things that are known, proven to be beneficial include the Mediterranean diet. You know, Mediterranean diet is really high in consumption of fresh fruits and vegetables, and actually good oils, nuts. All of these things are really well proven within the Mediterranean diet to be beneficial.
Gotcha. So we have a question that came in. They're wondering, is a Fitbit a good tool to monitor my heart?
Yeah, so no, that's absolutely a good question. So the Fitbit usually gives you information about tracking your steps, but it also tracks heart rate. Okay. And so heart rate is helpful because, you know, and I think it's helpful to talk to someone who is an exercise physiologist sometimes, but there are certain heart rate goals that tell you whether you are doing really high intensity activity or moderate intensity activity or not enough activity, you know. And so really being able to do moderate intensity, what I talked about, the 150 minutes is moderate intensity activity. There are different goals for high intensity activity, and that really is dependent on your heart rate. And there's a formula that's based on like your age and what your goal heart rates are. And so Fitbit can help you track whether you're in that range, because if you're checking your heart rate regularly.
That's really that's good to know. So we're getting a lot more questions. I want to thank you guys for all the questions. Please be sure to like it and share the conversation. And also thank you to Parkland Hospital and the Southwestern Medical Foundation for helping promote this. So next question. We've got one from Jessica. And we talked about this a little bit, but she's wondering, is heart disease hereditary? She says, I'm an African-American woman, so is this something I should be better aware of?
Absolutely. So in terms of the hereditary part, so we think in terms of prior studies that about 20% of risk is probably hereditary, where 80% of risk is probably modifiable. So what that means is your family history definitely plays a role, but don't underestimate the power and the ability of you to modify the risk by changing your lifestyle and keeping track of your risk factors. And I would say, as an African American woman, one of the big problems is high blood pressure. Hypertension is very prevalent, and so making sure, if you have a strong family history of high blood pressure, keeping track of that and understanding, like if your blood pressure is high, to treat it appropriately, and having it monitored regularly by a medical professional will help you assess your risk. And if you do have a strong family history where you have family members who have had heart problems at an early age, I would recommend more thorough evaluation of your personal risk factors so that you get a really personalized risk assessment.
So here's another one. This individual, she's apparently tracking, she uses Fitbit, she tracks her steps, her heartbeat. She says, you know, my blood pressure is very good, but my beats per minute seem high. Is that something she should worry about, or something she should talk to a physician about?
So it honestly depends, and we know a couple of things about heart rate. Is that so there are heart rate goals that we, in terms of intensity of activity, in terms of your personal heart rate. That there's a lot of nuances to it, in terms of how quickly your heart rate goes up and how fast your heart rate recovers. So those are all nuances that help to assess risk. And so it's hard to say without knowing your personal history in terms of whether your heart rate is appropriate or not. But if it's concerning to you, I would definitely ask your physician, you know, and if you track it, you know, being able to write down and bring numbers to your physician might be helpful in helping them assess whether it's okay or not.
So let's see. So Janie is wondering, what about a bicuspid aortic valve with moderate stenosis? I think they're asking thoughts on that.
So you know, what I mentioned before is that there's many different types of heart disease, you know, and I likened valves to the doors in your house. And so the aortic valve is one of the valves in your heart that allows blood to leave the heart and go to the rest of the body.
Okay.
It's usually a tricuspid, three-valve. There are three leaflets to the valve normally. It looks like a Mercedes-Benz sign when you see it on imaging. And so, but a congenital abnormality, so you're born with this abnormality, is a bicuspid aortic valve, where the valve is only two leaflets, or out of the three leaflets, two of them are fused, and so it's a functionally two leaflet valve. And what happens over time is that that valve can become stiffer and stiffer, or start leaking, or there are multiple problems. So what she's talking about is where the valve is slowly getting stiffer, where it's not opening as well. And there's different severities of how stiff the valve is. And so there's mild, moderate, and severe. And so it seems like it's in the moderate range, but that is something that needs to be followed by a cardiologist. And they would monitor over time, watch for symptoms, get regular echoes in order to assess for progression, because it is very likely to progress from moderate to severe. The timing depends on the person, but it is a problem that needs to be followed.
So great answers. And you know, we're going really well here. We have about 20 minutes left. We've got another question. This one is from Jessica. You know, Jessica, it talks about aspirin, and should we take aspirin daily? Also, is there a specific age we should begin to do this? I know aspirin's in the news a lot.
Yes, absolutely. So you know, so the reason why you would take aspirin in general, so this is broadly talked about, is aspirin has been shown to help prevent recurrent heart attacks in patients who have had heart attacks. And there is some data to suggest that aspirin, low-dose aspirin is what we're talking about. Low-dose aspirin taken regularly can help prevent your first heart attack or stroke. The tide has shifted significantly over time. So previously we were recommending aspirin to almost everyone. You know, not everyone, but a lot of people. And now the tide has shifted a little bit. And the reason why is because we know aspirin isn't without side effects. And so everything in medicine is a risk-benefit discussion, you know, and the downside of aspirin is the risk of bleeding. So aspirin is associated with an increased risk of GI bleeding, so that means gastrointestinal bleeding. And so we really like to now weigh the risks and benefits. But two interesting facts that we know about aspirin is that in men, it's known to more likely to prevent heart attacks, whereas in women, it's more likely to help prevent strokes. And so, you know, we start thinking about aspirin in women above the age of 55 who have high blood pressure. But it really is a risk-benefit discussion. And patients with diabetes who are at higher risk for heart disease, those are other people that we consider aspirin in, or women over the age of 65 to try to prevent heart attacks and strokes. But it is a risk-benefit discussion, so I would talk to your physician. If you do not have any risk factors, you know, probably the risk would outweigh the benefit. So it really depends on how many risk factors you have, what your underlying personal risk is of bleeding versus having a heart attack or a stroke.
Well, I know one of your personal areas of interest is women's heart health, and specifically pregnancy and heart disease. So I wanted to find out kind of how does pregnancy impact a normal heart? You know, what happens?
So I think this is so fascinating. You know, pregnancy is a very fascinating state in a woman's, in terms of the physiology that changes. So we know that and everything that changes is to help, is to allow adequate blood flow to the fetus and to protect the fetus. So all these changes that I'm going to describe, really the purpose of them is to protect the fetus. And so things that happen include an increase in blood volume. So the amount of blood circulating through your body actually increases. Your heart rate increases. Your blood pressure actually drops a little bit, especially during the second trimester. And the thought is that to reduce resistance to the blood flow is why we think that blood pressure goes down. And so you have a lot more volume going through your heart. Some of the chambers in your heart actually dilate or get a little bit bigger to accommodate this extra flow. And so there are marked changes that happen. And then, interestingly enough, it's also a little bit of a metabolic type syndrome. During pregnancy, your cholesterol level can go up. You have increased insulin resistance, so your body ability to take up sugar is a little bit reduced. And the thought being, again, that you want to prevent low blood sugar for the fetus, and so the body has a preventive, basically a protective mechanism where it increases the blood circulation of sugar in the mother in order to make sure that the fetus is always getting enough.
Is that where gestational diabetes comes in sometimes?
Yes, so exactly. So we know that there's a little bit of insulin resistance in everyone, but when over time, for certain women, the insulin resistance is significant enough to become what we call gestational diabetes, so diabetes that occurs only in pregnancy. And I think what's really remarkable about some of these changes, I think one of the things to remember is that a lot of these changes that happen during pregnancy actually resolve after pregnancy. And so what interesting, a lot of people thought that because they resolved, they didn't mean much, and that it was fine. If you had some diabetes or high blood pressure during pregnancy, it was fine. But what we know now is that pregnancy is actually acting like a stress test for women. So it's like a natural stress test that every woman who has a baby goes through, and I like to call it nature's stress test. And what happens is, if you develop some of these problems during pregnancy, such as gestational diabetes, gestational hypertension, preeclampsia, it's actually might be a way of uncovering a predisposition or likelihood to develop heart disease later in your life.
Okay.
So women who develop gestational diabetes are much, much more likely to develop diabetes after pregnancy, whether it's 5 years or 10 years down the road. More likely to have high blood pressure, and further down, more likely to have cardiovascular disease.
Wow.
And so I think we have to get away from the mindset that if it resolves after pregnancy, that it's not an issue anymore. I really think that women need to be aware that it is a problem, and that's something that needs to be followed over time.
So we've got another question here, but I wanted to follow up on that one. So if women come to you and they want to get pregnant and they have a heart condition, perhaps, how do you counsel them? What would you suggest? Are there things they can do?
Yeah. So the thing is that I think understanding that depending on the heart condition, we counsel women differently.
Right. That makes sense.
A lot of underlying congenital heart disease should be seen by a congenital heart disease specialist, because they have special needs in terms of things that need to be monitored over time. So there are certain conditions where we absolutely do not recommend pregnancy, but there are few, luckily few. There are certain cardiac conditions that once are fixed, then there's no problem with proceeding with pregnancy.
Gotcha.
But in general, if you're talking about a generally healthy person, the things that you can do are really try to be as healthy as possible before you conceive. Before you have your first pregnancy, try to be at a healthy weight, leading a healthy lifestyle, eating well, if you're gonna try conceiving, taking your prenatal vitamins or eating really healthy, just making sure that your nutrients, you have enough nutrients and there are no deficiencies. I think in general, that's what I would recommend, but there are specific conditions that require additional counseling. Yeah.
Okay, that makes sense. Well, as we go along, just wanted to thank you all again. It looks like we've got some great questions going. We've reached a bunch of people. Please continue to ask questions and love the conversation as we move along. So you talked about diet a second ago. So the next question is, you mentioned the Mediterranean diet. what are some healthy foods that Sarah can add to her diet on a daily basis to help her heart?
Yeah, no, that's a great question. So I think one of the things that I think in terms of dietary counseling, one of the first things I tell people is don't drink your calories. Okay?
Yeah.
So if you have a certain number of calories that you can take in a day in order to maintain your healthy weight or to lose weight, you can choose to either eat those calories or drink those calories. And I strongly recommend eating those calories, because drinking the calories are not going to make you full. And so you're likely to eat those calories anyway. In terms of things that you can include in your diet that provide a good source of nutrients as well as healthy fat that will keep you full, include almonds. So I often recommend, my patients keep a handful of almonds in their bag.
Okay.
And so if they get hungry during the day, they're not reaching for the chips or for something else. They're actually reaching for something that's healthy, but not too much. Everything, again, is in moderation.
So not a whole bag of almonds.
No, don't keep a whole bag of almonds and finish them off in one day. We're talking about a handful of almonds, just eating on a regular basis, eating once a day or throughout the day, that will provide healthy fat and has been shown to actually be beneficial.
Really good.
The other thing, avocados actually have good fat too.
Okay.
Really good monounsaturated fats that people who eat those regularly also, it's been shown to be beneficial. And so, I think it is somewhat of an acquired taste. And so, but if you are one of those people who likes them, there's so many ways to include avocados in your diet, whether it's through, slicing them on bread or eating it as guacamole. Just don't eat a lot of chips,
Right.
But there's a lot.
Salads.
Yeah, exactly. There's a lot of ways to incorporate avocado and good fat into your diet.
Okay.
But the last thing I would say is making sure you eat a lot of fiber. Fiber is actually really, really helpful in terms of all sorts of things, but soluble fiber and insoluble fiber, like oatmeal has good soluble fiber, and then fresh fruits and vegetables have a lot of insoluble fiber that will help you stay regular and also just keep you full.
Very nice. So we have 3 other questions.
Okay.
They keep coming in. All right. So Heather is wondering, how much sodium is recommended for a person both with and without heart disease?
So, I think in general, minimizing the amount of sodium intake is considered generally a good rule. And people with heart disease, especially patients with underlying high blood pressure or with heart failure. So those patients have basically are more likely to retain fluid, and fluid follows salt. So if you consume a lot of salt, you're more likely to have a lot of retain a lot more fluid. And so for both of those groups of people, we often recommend staying below 2 grams of sodium. And so
that's not very much.
No, it's not. And so, but it's sodium. It's not salt. So it's 2 grams of sodium, which is what is shown on most labels. And it is on almost all labels now have sodium. And so it's just keeping track of that. Things to avoid that have lots of sodium include canned foods, especially canned soups. They have, in order to preserve it, they add a lot of salt. Other things, actually, hidden salt is in bread. Bread actually has quite a bit of salt. And then adding salt to your diet, that salt shaker on the table, it all accumulates. And so, but just, most labels have that information, so just keeping track is really helpful.
So here's another one, and remember, we can't give specific medical advice, but it's a general question. This individual she says, I take cholesterol medication. There's a history of heart disease in my family. Should I be seeing a cardiologist?
Yeah, so, I think this comes up a lot in terms of family history, and I think one thing to remember is the age of the family history and what type of heart disease. So I think 2 pieces of information that are very powerful to take to your physician or to your doctor is what type of heart disease. So there's, like I mentioned earlier in our discussion, there's lots of different types of heart disease. And if you ask your family member specifically about coronary artery disease, so did they have a heart attack at an early age?
Okay.
Did they have a stent placed at an early age? Did they have a bypass surgery or any other problem related to the coronary arteries? That's what we're specifically talking about in terms of family history. Then ask them about the age. So if the woman was below your mother, your sister, or anyone was below the age of 65, or your father or anyone else was below the age of 55, that is definitely a red flag.
Okay. So
that tells you.
So if a relative, perhaps a grandmother, had a heart attack at 45 and has multiple stents, that's something probably to check.
Yes. So that is something that I would recommend seeing. Definitely a physician, and we have definitely a lot of preventive cardiologists or people who see preventive patients in terms of helping you assess your personal risk and understanding how you personally can modify your risk. We definitely can sit down and have a discussion about that specifically. And so, yes, and if that's your family history, if any of those fit with your family history, although cholesterol medications are definitely, something that can help prevent heart disease, it's important to have a discussion about what your personal risk is.
Okay, so let's see, we've got time for 2 more questions, and then we're going to call it a day. The first one is, what is the best way to reduce cholesterol naturally? Can that happen? Can you do that?
Yeah, fantastic question. So, within cholesterol, we hear that there's a lot of different types of cholesterol. There's, total cholesterol. There's LDL cholesterol, which is the bad cholesterol. There's HDL cholesterol, which is the good cholesterol, and triglycerides, which are basically fats in the bloodstream. And different things can help improve different cholesterol levels. Like for the bad cholesterol, the LDL cholesterol, trying to stay away from saturated and trans fat really can help reduce that LDL cholesterol. Soluble fiber can help reduce that LDL cholesterol. Things that can improve your HDL cholesterol: exercise, quitting smoking. If you stop smoking, that will often improve your HDL level. Triglycerides, if you're obese or overweight, losing weight, exercising can help reduce your triglyceride levels. So definitely a lot of things that can change with good lifestyle intervention. So that is absolutely the first step. And in terms of heart disease prevention, is really having a good lifestyle. The AHA has the Life Simple 7, which are 7 things, that if you focus on those 7 things, you are on your way to better heart health.
So Google Life Simple 7.
Yes, Life Simple 7, the American Heart Association.
All right, so we have one more question over time. It says, I think they're asking, how long could somebody have hypertension before it develops into cardiovascular disease?
That's a good question.
Interesting question.
Yeah, it is. So high blood pressure, can result in stiffening of the arteries around the heart and cause the heart to work harder in order to pump the blood against these stiff vessels. And it can actually, high blood pressure can affect the kidneys, it can affect the heart, it can increases your risk for stroke. So it can affect the entire body. In terms of timing, I don't have a good answer because there are people who have really, really, really high blood pressure that can develop a stroke or an event at an early age. Whereas there are people who have high blood pressure for many years that might not see the effect of it for many years. I think the important thing to know is that high blood pressure is often not felt. So people don't have symptoms unless it's really high, where they might have a headache or vision issues. But high blood pressure is often not felt, and so people stop taking their medications if they feel okay. And I think it's really important to remember that even if you don't feel the effects of high blood pressure, that taking your medications regularly, or if it's low enough, just making these lifestyle changes that we've discussed really can help keep blood pressure under control. Losing weight, exercising, all of these things, eating a low sodium diet can all affect your blood pressure and really keep it under good control.
That's good. I'm going to take one more minute
Yes,
of your
yes,
time because this is a good question that just came in. They say, I like to drink wine, and I wonder how it might affect my heart.
Yeah, that's a good
They're asking for a
yes,
friend.
yes. Not for themselves.
Not for themselves.
So red wine, or we really think we think it's like a U-shaped curve, and so what I mean by that is that patients who drink too much have problems, and there's like a sweet spot where about not more than 2 drinks per day for women actually might be protective for heart disease.
Red instead of white, or does it matter?
You know, there's mixed data on that, and so I think, but red wine definitely is considered one of the beverages, alcoholic beverages that, you know, if drank in moderate levels is probably beneficial for the heart. We know that alcohol can improve that HDL number. We don't recommend starting to drink alcohol in order to improve your heart health, but if you are drinking already, you know, keeping it at a moderate level is what our recommendation is. Okay.
Well, that is all the time we have today at UT Southwestern. Thank you, Dr.
Yeah,
Sanghavi, for joining us.
It was great.
Absolutely. And we will be, so the video will be available for you to share with your friends later. We'll post it so that you can continue to share it. You can go back and look at the information again. You can send it to loved ones. But anyway, thank you for joining us today.
Thank you so much.